Welcome. Welcome to our Meet the Docs for our Atrius patients who are planning to deliver at Beth Israel Hospital. We have been doing the Meet the Docs for quite a few years, and we really enjoy meeting our patients and telling you about us and having a chance to answer any of your questions that you may have about coming to the Beth Israel and having your baby with us. So the way that we start our meeting is by going around and introducing ourselves to you, and then we'll open it up to our most frequently asked questions. I'm Nada Samaha. I'm the OBGYN doc at Post Office Square, and I have been with Harvard Vanguard for many years, and am very interested in taking care of patients who come from all parts of the world. I'm going to pass it on to Dr. Yuzeko.
I'm Revitalia Haskell. I'm probably the newest member of the group. I joined the Harvard Vanguard Boston group in the fall. I grew up in Brookline, Mass, and have been practicing in the Boston area for a number of years, and I'm super excited to be a part of this group.
Dr. Dominguez.
Hi, I'm Anna Dominguez. I am the OBGYN hospitalist for the practice. So I do not see patients in the office. I work at the hospital full time, so I am there quite a bit. On a personal note, I have 2 daughters and a husband, and I enjoy spending my time with them and spending time outdoors, and I love cooking, and I love delivering babies, and I'm really looking forward to delivering your baby.
Dr. Dieffenbach.
I'm Kat Dieffenbach. I'm one of the generalist OBGYNs at the Copley office. And I am a Southern California transplant, but came to Boston for my training and then stayed here. And I'm excited to meet you all.
Dr. Richardson.
Hi, I'm Marcy Richardson. I am not the youngest member of the group. I've been at Beth Israel since 1965 and at Harvard Vanguard since 1988. I work at the Copley office. I'm a bit of a breastfeeding zealot, and I have 3 amazing grandchildren. I hope to see you soon.
Dr. Gagliardi.
Hi, I'm Liz Gagliardi. I work at the Post Office Square office. I have a toddler, and I grew up in the Boston area, and my special interest is taking care of high-risk patients.
Dr. Morin.
Hi, I'm Janice Morin. I'm one of the generalists out of the Copley office. Dr. Richardson is my roommate. I've been at Beth Israel for 20 years now. I have 2 children, 8 and 10. They keep me busy. I'm a huge sports fan. And I won't be mad if you don't root for the Bruins.
Dr. Brooks.
Hi, I'm Erin Brooks, and I am one of the doctors at the Post Office Square location. I did medical school and residency in Boston, residency at Beth Israel, and I have 2 children, 2 daughters, 1-year-old and a 3-year-old, all born at Beth Israel, and I am looking forward to helping you to have your baby at Beth Israel as well.
And Dr. Sharouk.
Hi, my name is Maya Sharouk. I'm one of the docs at the Copley office. I've been with the practice almost about 5 years now. I have a 9-month-old, which you might hear in the background, and I apologize for that. But am loving to chat with you about any questions. And one of the big conversations I love to have with my patients is about exercise in pregnancy and postpartum. So happy to chat about that too.
Dr. Chung.
Hi, my name is Shirley Chung. I'm at the Post Office Square office, and I've been in Boston for 20 years, and I've been at Harvard Vanguard that entire time. and I'm very proud to be in this group. I have two children. They are 11 years, I have an 11-year-old daughter and a 13-year-old son, and my family lives in Newton, so very close to the hospital.
Dr. DeGroot.
Hi, I'm Patty DeGroot. I am a generalist at Post Office Square. I've been with Harvard Vanguard since 1994, so a long time. And I have 4 20-something, you can call them grown kids. And we're so excited to bring this new venue to you guys who have been working from home and hanging out. And we can't wait to meet you for real on the labor floor and deliver your babies.
Dr. Friedis.
Hi, I'm Jonathan Fetus. I practice general OBGYN at the Kenmore office. I've been with Harvard Vanguard for 27 years. I have 2 kids, 16 and 18. And I also enjoy early music, cycling, and practicing quarantine cooking. And you can also see my quarantine haircut. I look forward to meeting people in person on labor and delivery.
Dr. Moy.
Hi, I'm Victoria Moy. I practice out of the Quincy office. I am originally from New York City, but I've lived all over the Northeast. I've been with Harvard Vanguard for 4 years now after some time abroad in East Africa. So I love taking care of patients from all over the world and different backgrounds. I also have a 2-year-old, so look forward to meeting you.
Dr. Sloan.
Hi, my name is Jamie Sloan. I'm at the Kenmore office. I've been practicing at Harvard Vanguard for the last 10 years. I have 3 children. I'm in one of their rooms now. It's the quietest room in our virtual household. So this is where I do most of my telehealth. And I look forward to meeting you at the hospital.
Dr. Perrin.
Hi, my name's Emily Perrin. I'm actually the physician that's on call today, so I'm representing you from our call room at Beth Israel Hospital. I am currently out of the Quincy office. I was born and raised, grew up in Maine. I did my residency training in Philadelphia. I've now been in Boston for about 7 years and really love taking care of patients and looking forward to having you here on labor and delivery.
Excellent. So thank you all for introducing yourselves. We're going to go ahead and go around and cover some of our most frequently asked questions. And we'll start with Revi talking to us about when and how do I call and where do I go? Revi?
Definitely. So if you need to call us with anything that's going on, basically just call your office number. So the same number that you would call to make appointments or that you would call with any other question, use that number 24 hours a day, 7 days a week. If it's during business hours, you'll connect with one of our nurses or one of our doctors, and we will talk with you, find out what's going on, and make a plan with you. If we tell you to come into the office, then come on in to wherever we make you an appointment, and we will see you there. Sometimes we'll instruct you to go to the hospital, and if that's the case, you're going to be going to Beth Israel Hospital, to the East Campus. Make sure it's East, not West, and up on the 10th floor is the location of labor and delivery. If it's after hours or weekends, you still use that same number. You'll be connected with our answering service, and they will take your message and connect you with the doctor on call, and then give you further instructions from there. So one number, that's all you need to know.
Dr. Dominguez is going to talk to us about how do we cover our on-call and what our shifts look like and what is our backup system.
Hi, so in terms of who's going to be delivering your baby, that sort of answers the question of, who is covering call. It will be one of the 15 of us that you are seeing. So you will always be delivered by one of us, about nearly 100% of the time, and I'll talk a little bit more about that. So always be a Harvard Vanguard physician in a delivery. In terms of our shifts, we worked 12-hour shifts. So they're 7:30 in the morning till 7:30 at night. Another person comes on at 7:30 at night until 7:30 the next morning. So going back to my comment about one of us always being present, there are times, and it is not common, but there are times when there are 2 Harvard Vanguard deliveries or 2 Harvard Vanguard sort of clinical situations going on simultaneously, and we would love to be in both places at the same time, but we can't. And that is a situation where you might meet another attending obstetrician to attend to your delivery. And so we do have an arrangement with one of the other practices that is also in-house at the hospital that is ready and prepared to help us in such a situation. So in addition to other people that might be at the delivery, which I think Dr. Gagliardi might be talking about, there will always be an attending physician at the delivery. If it is not one of us, which will be most of the time, then we do have a backup system with one of the private practices.
Thank you. Dr. Dieffenbach is going to talk to us about what should I be bringing with me to the hospital, which is something that patients ask us all the time.
So rest assured that everything you really need is going to be available to you at the hospital. So there isn't anything critical at this point that you could possibly forget, aside from the car seat for the baby. There will be food that you can have available to you. There will also be things like socks, a Johnny to wear, toiletries for taking a shower. All of those things are there if you want them. I think many patients find that they prefer to bring in their own things like slippers, some chapstick, or lip balm during labor. Your mouth can get a little dry. Things like little snacks that you personally prefer are always a good idea. Many people bring in like a playlist that they have on their phone, music playlist. In our current environment, in terms of coronavirus, COVID-19, it's really important that you understand that everything that you want or need, you need to bring in with you when you present to labor and delivery, and that includes your car seat. So the car seat is really the vital component because we won't let you take baby home without it. But aside from that, these are really just comfort items that you may choose to bring in. But again, I just want to reinforce that everything you really need, we're going to be able to provide for you.
Dr. Richardson is going to talk to us about what are our options for our patients for pain relief when they're in labor.
Well, I have some bad news because labor hurts. But it's manageable, and we all got here through labor, most of us at least. At Beth Israel, we have an excellent anesthesia department, and most of our patients have anesthesia in the form of an epidural. Now, we do have some patients who want to do natural childbirth, and we support that too. But if you choose an epidural, that's a needle that's put into your back, and then there's a catheter. And the important thing about the epidural is that the nerves come out of the spine, and the pain nerves are on the outside, and the motor nerves that control the muscles are on the inside. So the perfect epidural will make your labor painless, but you'll still be able to push your baby out. Now, life isn't perfect, so it doesn't always work out exactly that way, but we do pretty well. Some of you may have heard about something called the walking epidural. Well, that is kind of a dream, because actually the motor pain relationship doesn't usually allow women to walk. And it's very hard to walk if you can't really feel your legs. Get your epidural depends on how you're tolerating your labor and what kind of progress you're making. And it's never too late to get an epidural unless you hear your baby crying. And if you hear your baby crying, you don't need the epidural. Are there other options? Yup. we often give women a cocktail of narcotics to help them during their early labor. People often ask us if we have nitrous at the BI, and for reasons of what the anesthesia department feels that nitrous isn't entirely safe for all the staff, and it hasn't been shown to be that effective. So to date, we haven't had nitrous available at our practice. There is, or there used to be pre-COVID, a monthly Meet the Anesthesiologist meeting for those of you who might be interested in it. But we'll help you be comfortable during your labor. I should say one other thing, which is that it doesn't make all of the pain go away. You usually feel some pressure. And lastly, for most of our C-sections, you'll be awake. The epidural can be given for an effective dose for C-section.
Thank you. Dr. Gagliardi, can you talk to us about how we work with our residents at the Beth Israel?
Yeah, so there will be residents involved in your care, both anesthesia residents and obstetrical residents. Our residents are from Harvard Medical School, and they are intelligent and kind and empathetic, and it's a wonderful gift that they are involved in your care because they give us an extra person to support you, but also another person to be setting another set of eyes to be paying attention to everything that's going on with you. So we do work as a team. They won't be making any independent decisions or doing any interventions without reviewing the whole plan with us. You may not see a resident the whole time you're there, but usually they will be involved at some point in your care. Often they'll be one of the first people you meet because they'll come in and take a full history from you, and sort of make sure that we're not missing anything that's been going on, long ago in your history or currently in your history in the last 12 to 24 hours or since you last were seen by our team outpatient. They will be involved in your delivery. Most of our vaginal deliveries are attended by a resident, but there's always an attending physician, one of the people in front of you at that delivery as well. You may hear us teaching them while we're doing the delivery, so they're learning in real time as well. Specifically with cesarean sections, there's always two doctors to do a cesarean section, 2 surgeons. So the residents will always be present to assist us while we're doing your surgery. And I cannot stress how much I feel that having residents involved in your care adds to your care and really enhances your experience.
Thank you. Dr. Morin is going to talk to us about who's allowed in the room with you on labor and delivery, postpartum, and in a cesarean.
Sure. So, in general, of course, pre-COVID, the visitor policy was more relaxed. We really didn't limit the number of people that you could have with you in your labor room or postpartum. There were quiet hours on the floor from 9 p.m. until 6 a.m. where we turn the lights down and we try to keep the noise down, but we really tried to let people have who they wanted with them in the hospital. And we didn't really have a number cut off. I always remind people, though, that, the labor rooms are small, postpartum rooms are small. So the number of people that they had, it could get pretty crowded. And we would allow one person to stay overnight with you in the hospital. Now, in the world of COVID, we have more restrictive visitor policies. One thing that we have been very committed to during this whole time is allowing women to have a support person with them. We feel that that's very important for the family, for outcomes, and this is something that we feel very strongly about. Now, obviously, things are always changing with COVID, but this is something that we have always allowed, even through this whole COVID situation, is one support person. That support person needs to be healthy, so they will be screened and asked questions about symptoms of COVID and also any potential contacts with somebody who has been COVID positive. So it's important that we try to self-quarantine at least a couple of weeks before we think we're going to deliver, knowing that, you know, babies are going to come when they want to come, but we are asking people to try to self-quarantine for 2 weeks before their baby comes. In this way, trying to limit the potential exposures and making sure that the support person that you want to be there with you is there with you. That support person will be admitted to the hospital with you, not as a patient, but you will come in as a unit, as a family unit, and that person will stay with you and that throughout the hospital stay, and then go home with you when you're ready to be discharged. So that one person will not be allowed to go in and out of the hospital. You will stay together. With epidurals, if you choose to get an epidural, like Dr. Richardson was talking about, that support person will be with you. We do separate a little bit for the procedure, but they will be with you. And then if you require a C-section for whatever reason, you will have that support person with you in the operating room, unless it is a rare situation, for example, where somebody needs to have general anesthesia. But as Dr. Richardson alluded to, most of our patients with C-sections, we do those with epidurals as well. So the answer is right now you get one person, and that person needs to be healthy.
Dr. Brooks. Dr. Brooks is going to talk to us about how do we get help with breastfeeding, and where does the baby spend its time when the baby is delivered?
So if your goal is to breastfeed, there is going to be plenty of help available to you at the hospital. All of our doctors and nurses are very well trained and very familiar with helping new moms to learn to breastfeed, helping remind moms who are not having their second baby or not having their first baby how to breastfeed a newborn as well. And so every nurse that you have on helping to take care of you, as well as your doctors, are going to be able to help you learn to get your baby to latch, get you to do skin to skin as soon as is possible after your delivery, which also helps to facilitate that. Anytime moms need a little bit of extra help, we also have dedicated lactation consultants available who work every day. And so shortly, not too long after your delivery, sometimes the same day, oftentimes the next day after, if you need it, additional help, you will have access to a dedicated lactation consultant as well. Once you leave the hospital, I think there's a number of wonderful lactation consultants in the community that you can also access. You can talk to your primary team or your primary office about which lactation groups are good and located close to your house. Right now in the COVID era, I know that there are a number of really great lactation consultants who are doing telehealth visits. I know that New England Mothers First is doing telehealth, and I believe Boston NAPS as well. And those are organizations that I refer to often. In pre-COVID era, there's also a lot of drop-in called baby cafes, which would be sort of almost a support group type atmosphere where lactation consultants will kind of have office hours that you can drop into. Hopefully we'll have those again soon as well. And there also is a support group at Beth Israel for breastfeeding that's currently not running, but hopefully in the near future we will have that available as well.
And Dr. Bruce, would you address where the baby spends its time after the baby's delivered?
Yeah. So rooming in is our standard. And what rooming in means is that all of the baby's care and routine procedures and testing is done in the room with you. So baby never has to go to the nursery. Baths, hearing tests, all the things that happen for the baby after they're born are done in your room. We do have a nursery though on each postpartum floor. And so if you want to use the nursery to get a little bit of rest or then that is still available.
Thank you. Dr. Sharuk. Dr. Sharuk is going to talk to us about how long do our moms stay in the hospital?
So in general terms, moms and their support person, if desired, after a vaginal delivery can stay up to 2 nights after delivery, and after a cesarean up to 4 nights after delivery. If you happen to deliver on the later side that particular day, typically after about 8:30 p.m., that night does not count as one of your nights that you can stay in the hospital. If you are feeling particularly good, like the next day after a vaginal delivery, or let's say on day 3 after a cesarean, and everything is looking good for you and for baby, then we can discharge you early as well so that you can be at home. Currently in this kind of COVID era, we are encouraging people, and I think the vast majority of our patients do want to leave on that earlier side, whether that's day 1 after a vaginal delivery or day 3 after a cesarean, just so that they can limit the time that they are there in the hospital. That being said, if you feel very uncomfortable with that, or you need the extra support, then you will by no means will be forced out of the hospital. Again, all of this depends that you had no complications and that there isn't anything else we're trying to monitor or manage, because that can always extend your stay, mostly for your safety or for the baby's safety.
Dr. Chung. Dr. Chung is going to talk to us about circumcisions. And she's going to talk to us about when do we do them and how do we do them.
So circumcision, the decision should be made before you actually come into labor. So you should have a discussion with your primary obstetrician before you deliver, so that you, whether you know you're having a boy or not, you should have the discussion. So it won't be something you would be discussing at that time. So if you do decide to have a circumcision, it's typically done 1 to 2 days postpartum, whether you have a vaginal delivery or a C-section, it's done 1 or 2 days after. And it's usually done mid-morning or late morning. Sometimes it will be done early afternoon, but those are generally the times that it's done. And the doctor who's going to do the circumcision, all of us can do a circumcision. We've done many, many, many of them. And the doctor who comes into the room, and they will introduce themselves, and then they'll consent you. They'll discuss with you the consent, and they'll go over some of the risks of having a circumcision, and then they'll go over pain options. Babies will typically get some Novocaine or lidocaine anesthesia around the penis area, and then they'll go over the whether or not you opt to have some Tylenol for the baby to help with pain management. Also, the doctor will go over whether you're okay with having a pacifier and a little sweet water or sugar water. Those 3 things have to be consented by you guys before we give that to the baby. And then after you go over the consent, the doctor who's doing the procedure will take the baby to the nursery on the floor, and then everything will be confirmed. The baby will be identified at multiple times through the name and the ID and the date of birth, and everything is confirmed to be sterilized. And then they will do the procedure, and the circumcision procedure is actually fairly quick. It's only a few minutes. It does not take a long time. And once the procedure is done, then the baby will stay in the nursery, and the nurse will do a check for bleeding, and that's done about 15 minutes post-procedure or post-circumcision. And then the baby will be brought back to you probably around 30 minutes after the procedure is done, or you can come and get your baby. And then the nurse does another check 60 minutes later, and then they do another check 12 hours later. And that's how it's done.
Great. Dr. DeGroot, can you talk to us about episiotomies, and do we routinely cut them? And what do you think about other options, including perineal massage?
So absolutely. So episiotomies are definitely not routine in our practice, and they're not considered to be routine in obstetrical care generally. We only do a couple of percentage of our patients have episiotomies, And they're done only in situations where we absolutely have to get the baby out, or if the shoulders aren't coming out and several of the maneuvers we normally do aren't working, we would make a small cut in the perineum that will help give it more space to deliver the baby. That said, even though we don't do episiotomies routinely, most women having their first baby do have some sort of tearing, either vaginally or in the perineum or both. We have maneuvers that we perform at the time of delivery to try to minimize and prevent tearing. However, we can't always predict the amount of tearing. Sometimes it looks like the patient is going to tear extensively and they don't. And sometimes it's unclear and they do, but expect that you will have some tearing. It might be minor. So what can you do to help minimize or prevent tearing? Well, it's always a good idea to stay flexible and exercise during pregnancy. And the question comes up about perineal massage, which involves massage and stretching of some of the muscles in the perineum. This is something that has been studied over the years, and but most recently there was actually a randomized controlled trial published in the last couple of years that did actually show the benefits of perineal massage. It was statistically significant in decreasing the episiotomy rate and also decreasing the extent of the tear. So even if you do tear, perineal massage may help you tear less than you would have if you hadn't not performed it. It's performed for about 5 minutes. It only takes about 5 minutes, and it's performed for about 3 to 4 weeks prior to your delivery, and you have to do it daily. So my recommendation is, if you have questions about this, to talk to your OB providers, especially your nurse practitioner or midwife. And perineal massage, which is spelled Perineal massage. If you just look it up on the internet, you'll see all kinds of information and instructions as to how to perform this maneuver. I want to re-emphasize that while most of you will have some level of tearing, that most of these are what we consider to be normal tearing, and that the vast majority, 95+%, heal up fine, and that you will heal and have no pain going forward, and you will be able to resume sexual activity. It can take a little bit of time, but I just want to reassure everyone not to be fearful if you do have a tear. For the tiny percentage of people that have issues with their tearing or with an episiotomy, say, postpartum, we have things we can do to help those individuals as well. One of the most important things that you can do with tearing afterward is we actually have sitz bathtubs which is basically a basin that is in the hospital. It's in the bathroom in the hospital, and the nurses will talk to you about that, and you take that home with you. That involves just soaking in plain hot water, warm, hot, not burning you hot, but hot water like a bathtub, for about 10 minutes. And you do that a couple of times a day, every day. And that is the most important thing you can do to facilitate healing of any stitching and tearing that you have, or an episiotomy.
Great, thank you. Dr. Freedes. Dr. Freedes is going to talk to us about who's going to be in the room with you at the time of delivery and what happens at the time of delivery.
Okay, so I think the question of who, in terms of a support person, is going to be with you has already been addressed. So I'm going to be talking about the sort of hospital and medical personnel who are going to be there. Fortunately, most of the time when we do deliveries, everything is nice and normal. And in that circumstance, the people who would be with you would be your labor nurse, and under most circumstances, there's one-to-one care. So that nurse will, in many cases, have been with you for a few hours, if not more. They do switch off, just as we do, but you will generally have gotten a chance to know this person. So your labor nurse will be there with you. They call very much towards the end another nurse whose job it is to take care of the baby, the so-called baby nurse, so that your labor nurse can be sort of more attentive just to what's going on with you. There will also be, as was previously noted, one of us, one of the senior obstetricians, and one of the residents generally. And that's sort of the core people who will be there. If there is anything unusual going on, there might be some pediatricians, some people from the newborn intensive care unit. You can recognize them because they travel in flocks and they wear yellow gowns. A lot of times they're called for pretty minor things. For example, if the baby has a little bowel movement inside, it's called meconium, it's quite common. They automatically get called, even though in the overwhelming majority of cases, all they do is take a look and say, baby looks great, see you later. But they are also around in case the baby needs more attention. Also, if you need a something like a vacuum delivery or a forceps delivery, the baby doctors will get called, and they also get called sometimes for other things, such as if there's been a question about how the heart rate tracing looks, or if you've had a fever, or if you've gotten certain medications. Those would also be reasons why the newborn intensive care unit doctors will get called. Although, as I said, in most cases, they sort of check things out and go home. If you end up I should also say that occasionally, if, for example, things are a little bit more involved, if, for example, there's some extra bleeding, there might be one or more other nurses coming in. The resource nurse, the nurse who's sort of running the floor, sometimes comes in. And you'll also probably be meeting some anesthesiologists as well. If you were to need a cesarean section, your labor nurse actually does go with you, so you'll be seeing a familiar face in addition to our face. Also, as was previously mentioned, I believe by Dr. Gagliardi, there will be a resident, and then also, again, there would be a couple of anesthesiologists, and again, sometimes we have the NICU team come by. Generally, as far as what goes on at the time of delivery, and I'll just mostly talk about the fairly normal deliveries, we deliver the baby. We really like to do skin to skin. So we deliver the baby, and unless you tell us otherwise, usually what we try to do is bring the baby right up to your chest. A lot of times people want delayed cord clamping, and we, unless there's a very compelling reason not to do that, we'll do that. Your support person can cut the cord in most cases if he or she wants. And we really do everything we can to keep you and the baby together when right after the baby is born. If it is a cesarean section, we again try to, they'll check the baby out really quickly and then usually bring the baby over to your support person who will be sitting right next to you, so you can see the baby even if you can't immediately hold the baby.
Okay. Dr. Moy. Dr. Moy is going to talk to us about how do we choose a pediatrician and when will the pediatrician examine the baby?
So people choose pediatricians in various different ways. Some patients choose pediatricians based on word of mouth. So friends, family, if they have a recommendation, some people will go that route. Others will choose pediatricians that actually took care of them as children if they grew up in this area. And if you don't have either of those options, we have a really great team of pediatricians here with Harvard Vanguard. We have pediatricians at almost all of our sites, including family medicine at some of our sites, which sees both pediatrics and into adulthood. We have great resources online in which you can look at our Harvard Vanguard website and our Atrius website, and it will direct you to various sites. So for patients who are seen in Boston but live outside of Boston, we actually have great offices out in the suburbs as well. In terms of how to choose one within Harvard Vanguard, each physician and nurse practitioner on the website has a little bit of a bio, so you can read about that, and you can also see who is accepting new patients at this time. I do encourage people to choose an office that is convenient for them. After the baby is born, you will often have to go to the pediatrics office several times. It could be even a couple times a week. It can be once a week for the immediate future. In terms of who sees the patient postpartum or after the baby's born, we do have pediatricians in the hospital who will do the initial baby evaluation, and some of our some of our pediatricians from Harvard Vanguard actually do come to BI for their patients. So I would definitely check with your primary office for the details of that. Once the baby's evaluated by the pediatrician in the hospital, they will tell you before discharge when they would like the baby seen. It is at that time that you should call the office of your choice and schedule your first visit with that office. These pediatricians' offices do a great job of having availability for newborns, so you should not have any issues with finding an appointment, even if it's one day after you're discharged from the hospital. The pediatricians in the hospital will also send your records over to the office of your choice so that they're up to date with everything that happened while the baby was in the hospital. You do not have to call our Harvard Vanguard pediatrics offices prior to delivery. We actually can't make an appointment before the baby is born. So I would encourage you to just have their information for when you're at the hospital at delivery and before you go home.
Dr. Sloan. Dr. Sloan's going to talk to us about what happens if you need an induction of labor.
So induction of labor can happen for a couple of different reasons. Some reasons might be for the baby, others for the mom. If you have conditions like high blood pressure or diabetes, that might be a reason to induce the baby or induce the labor. Also, if you go after your due date, somewhere between 41 and 42 weeks, if everything else is normal, would be a time where we would encourage the baby to come out with some medications. So some of those medicines that we would use are something called Cytotec or misoprostol, and that medicine can be taken either vaginally or orally. Sometimes we use a Foley catheter, which is a little balloon that goes into the cervix and mechanically opens it up. Sometimes we use Pitocin, which is contraction medicine that goes into the IV. And sometimes we will break your bag of water to help encourage the baby to make an appearance. Sometimes before this process starts, around 40 weeks or so, your doctor may talk to you also about stripping your membranes or stretching the cervix. There's good evidence that doing this can reduce the rate of induction. I think the thing that surprises people the most about induction is that it can take several days from the time you're initially at the hospital for your first dose of medication to meet the baby, especially when it's your first baby. So you may get several rounds of medication before you get into active labor. And so it's important to sort of pace yourself when you're at the hospital. I know it's exciting, but nap when you can, especially with an induction. Typically, when we're going to do an induction, we'll see you in the office a couple days before we would plan to schedule that. And we send a booking form to our central scheduling office, and they usually will get back to you within 24 to 48 hours of that booking form being sent. And the medical staff at the Beth Israel Hospital will prioritize inductions based on medical indication and get back to you. Before you leave for the hospital, the schedulers will give you the information to call labor and delivery. This is the only time that you need to call labor and delivery, is if you're having an induction. So before you leave for the hospital, we want you to give them a call, because sometimes the labor floor can be very, very busy. And for safety purposes, we wouldn't want to start an induction to create more busyness on the floor. If there is a concern for the health of you or your baby, we will schedule some additional monitoring to make sure that everyone is safe in the event that we can't have you come in. Typically, this is not an issue, but we do encourage you to call ahead of time and just be flexible. Our goal is always a healthy mom and a healthy baby, and we'll get there some way, one or the other. With an induction too, that doesn't always mean, I know there's sort of a misnomer out there that that can increase the rate of C-section, and that's not the case. But we will sort of help you get delivered and we will support you in that process, however it goes.
Dr. Perrin, can you talk to us about the availability of showers and birthing tubs on labor and delivery?
Sure, absolutely. So here on labor and delivery, we have showers are available for hydrotherapy, which is another method of pain control. They aren't in your room, however, they are accessible just across the hall. They are semi-private, so you're going to be in a room with your shower, and you can use that either in the early part of labor to help you prolong the time in between when you have painful contractions and when you would like to have an epidural. Some people will use it to help them get over the hump of the more active phase of labor to have a natural delivery. We do have one room with a tub. It sometimes is taken, and sometimes we cannot guarantee that you're going to be that room will be available. So it is always helpful to tell your obstetrician in the office if that's something that you're interested in.
Thank you. Dr. Richardson, we're going to have you talk to us about cord blood banking. I know that's one of your favorite topics.
This has been great. I have great partners. So cord blood banking is when you take the blood from the baby's umbilical cord and save it, because these are very immature cells and they can sometimes be used to treat problems and actually provide a transplant. There are two kinds of cord blood banking. There's public cord blood banking and private cord blood banking. And many of you will have been solicited to sign up for private cord blood banking. But honestly, our professional organizations, including ACOG, the American College of OBGYN, and the American Academy of Pediatrics, don't really endorse private cord blood banking because mostly because we feel that the likelihood that you will need this is very low. And secondly, that you don't really want to use the cord blood from the baby to treat something that the baby has as a problem. However, if you opt to do cord blood banking, we're happy to collect it for you. But also at Beth Israel, there is an option for public cord blood banking where you donate the cord blood to a cord blood bank, and then it can be distributed throughout the country. And that's available from Monday morning until Friday evening. And in order to do that, you need to go on the Beth Israel website, and there's a consent form there that you need to sign. This is going on in the time of COVID, and it's a generous thing to do. There is more information about it on the website, and again, of course, we're happy to participate in that with you. Thanks.
So we have covered most of the questions that we get asked about for our Meet the Docs, and I want to take a moment to thank you all for joining us today for our Meet the Docs. And what we're going to do is we're going to go around and reintroduce ourselves rapidly and tell you which site we come from. So I'm Nada Samaha, and I work at our Post Office Square office. Revi?
I'm Revitalia Heskell, and I work at the Kenmore office.
Anna?
Hi, I'm Anna Dominguez, and I'm the OBGYN hospitalist for the practice.
Kat?
I'm Kat Dieffenbach. I'm a general.
Marcy?
Richardson, I work at Copley.
Liz?
I'm Liz Gagliardi, and I work at Post Office Square.
And Denise?
Hi, Denise Morin, and I work out of Copley.
Erin?
I'm Erin Brooks, and I work out of Post Office Square.
And Maya?
I'm Maya Sharuk, and I work out of Copley.
Shirley?
I'm Shirley Chung, and I work at Post Office Square.
Patty.
I'm Patty DeGroot. I work at Post Office Square.
Jonathan.
Hi, I'm Jonathan Fetus, and I work at Kenmore.
Vicky.
I'm Victoria Moy. I work out of Quincy.
And Jamie.
I'm Jamie Sloan, and I work out of Kenmore.
And Emily. Emily might have gotten called for a delivery. So Emily Parent is our on-call doc, and she works out of Quincy. And so if you have any questions that we may not have covered during our Meet the Docs today, please bring the question back to your OB provider in the office, and we'll be sure to answer any of your questions. And thank you again for being with us today, and we look forward to seeing you soon. Take care.